transcript. Yeah, the recording is on.
Excellent.
Yeah, yeah. Are you able to see the screen?
Yeah, thank you so much.
Yeah. Shall I open the 3 minutes?
Yeah, and then if I wanted to scroll down, I'll ask you to do
Yeah,
that.
sure. Will do. Okay. So the 3 minutes with you.
Perfect. Mhm. Can you scroll down, please? Mhm. Again, you don't go scroll down, please. Mhm.
That's the end.
Yeah. Is that the end? Oh, okay.
Yeah, that's the last. Would you like me to scroll up?
Yeah, maybe scroll up, please. Yeah, thank you.
Okay, happy to start?
Yeah.
Okay, go ahead.
Hello, my name is Dr. Marwa. I'm one of the doctors in the GP surgery. Am I speaking with Jack Mack?
Oh yeah, doctor, I'm Jack Mack.
Hi, can you confirm your age, please?
I'm 40 years, doctor.
Okay. So, you have requested a video consultation. How can I help you today?
Oh, doctor, I feel that this promethazine is not working, doctor.
Mhm.
So the mental health consultant told me that medication will help me to sleep, but I don't feel anything. It's really not helping. And if I'm not
Mm.
sleeping, I can't control the voices and all of these things around, and I'm worried that I will lose control of my schizophrenia, doctor.
I see. I hear your concern, and I'm happy to address it. Can I ask you a few questions before we move forward? Is that all right?
Yeah, sure, doctor.
So, from the letter that I received, did you get the letter?
Uh, yeah, I think, yeah, they discussed it with me that they want the promethazine to be added
Yeah,
to my medication,
yeah.
and
Mhm.
again, it didn't help. I think I need lorazepam, doctor.
Lorazepam, fine. I'm happy to discuss lorazepam or other modalities or other methods in a minute, but just to recap, you went to the psychiatrist and they you were on olanzapine, and to help you sleep, they added promethazine
Yeah.
twice a day. Is that right?
Oh yeah, doctor. Yeah.
And how long has that been going on for? Or when did you start
Mm,
using the promethazine?
a month now, doctor.
A
A
month ago.
month.
Okay. And is it not helping at all?
No, nothing. Like I'm not taking anything.
Tell me more about your sleep.
Well, doctor, I can't sleep at night at all.
Mhm. At all. And is it a problem going to bed, or is it a problem like waking up in the middle of the night? Or tell me more about that.
Well, once I reach my bed, I keep scratching and I can't sleep.
Scratching. Tell me more about scratching.
Well, doctor, there is these bugs all over my house,
Hmm.
and they are keep biting me.
Okay.
Yeah, so I don't know what to do. I buy a lot of, sprays and this, and these bugs are not going. I'm not sure what to
Mm,
do with these bugs. And they are only
okay.
active at night time, and they will
Only
keep,
active at
yeah,
nighttime.
they keep
Uh, uh,
biting me.
hmm. And did like when did you start noticing the bugs?
Well, I think it's like 2 months now.
2 months ago.
Yeah,
And
and
um, mhm.
yeah, go ahead.
Yeah, and do you feel, can you see the bugs?
Oh yeah, doctor, I am seeing them. I kill loads of them, but they are never ending.
Oh, I see. And can you see them after you killed them?
Oh yeah, doctor. Yeah, I'm not imagining them. There is true bugs
I
there,
see.
doctor. I think there is infestation in the house. I'm not
Infestation in
sure.
the
Yeah,
house.
I'm not sure what to do.
Yeah. Who else lives at home?
Well, it's assisted living, doctor. Or so uh, there is a warden. We did tell her, but she's not. I think she's not interested at all.
I see. And do you have any rashes anywhere?
Well, yeah, I got some rashes, but I buy some creams over, from the pharmacy. It did help with the rash.
Okay, okay. And where are the rashes in general?
All over, doctor. They are biting me everywhere and anywhere.
Everywhere. I see. Okay. And is anyone else in the accommodation suffering with that?
Yeah,
I
but no
see.
one is doing anything,
No one
doctor.
is doing anything.
No.
And they're and as you mentioned, they are more bugging you at night, and they're not making you sleep. Is that right?
Yeah.
I see. Okay. Like, and any other any fever or anything?
No, no fever, doctor. But
No.
the yeah.
Sorry. And when you let me ask you a few questions about your mental health and the olanzapine. Do you hear any voices right now?
No, not right now. Mostly at night time. It's always like that, doctor. If I don't get a good night's sleep, the voices will, the voices is always there, but I can't fight them.
You
But when
can't
I'm
fight
not
that.
sleeping, I can't. When I'm not sleeping, they will take the control on me. So
Oh,
until now, I'm able to resist them. But if I continue like that, I know that the things will become worse, and I don't want to be admitted again to the hospital.
I can see that it's really affecting you, hasn't it, Jack?
Yeah.
Ah, so from what I heard, there are a few things. Number one, you want to talk about or you want to get or you want to address sleep issue. You want to address itching. You are really passionate about not getting worse in terms of the hallucinations, not wanting to being admitted to hospital, and you also mentioned like diazepam. is there anything else you were hoping for
No, not
out of today's
diazepam, Doctor.
consultation?
Lorazepam.
Oh,
Diazepam is,
lorazepam,
yeah, is
sorry.
making me very sleepy. Lorazepam.
I see. Is there anything else you were else hoping out of this consultation?
No, no, not really. Doctor. No.
Okay, fine. So, Jack, look, uh, it's easy for me to prescribe lorazepam. However, I think that I want to really solve the issue of you going to sleep. I don't want you um, uh, to take a medication after a medication that will not be helpful. And I'm with you. I don't want you to deteriorate in terms of your mental health and in terms of the hallucination. Is that right?
Oh yeah.
So, from what you mentioned, I'm I'm thinking it could be something else that is a bother, like that's affecting your sleep, the bugs. And especially that you mentioned you're having the rash and itching at night. I'm afraid you might be having something called scabies. Have you heard of that?
Oh no, no. But what? But why you think I have scabies?
Yeah, because you mentioned a few things. You mentioned that you are scratching more at night. There is some rash in your body, and a few other people in the accommodation are suffering from that. It could be scabies. Do you know what scabies is?
No, 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 not really, Doctor. But I'm seeing the bugs.
I see. Then it could be also like it could be also like a bed bug that you have.
Okay, so what should I do?
Yeah. So I would like to examine you.
Okay,
Okay.
what you would
I
like
would
to
like to
examine?
examine you. I will bring say that again.
What you would like to examine?
Yeah, I would like to examine your rash. I would like to examine the the your skin, and if you have bed bug, I would like to see like if you can bring in a bag or something. I would like to see them
I have photos for them,
and see
Doctor.
what's you have photos.
Yeah, I
Excellent.
did take for with my phone because people are keep not believing me. They think that it's part of my schizophrenia.
No,
So
no,
yeah, they
no.
think that I'm imagining the bugs, but I took photo of them and I will show it to you.
Yeah. So I'm happy to see them. Sorry, I'm happy to see the photo. I would like to see you, examine you, see what's going on. In terms of tonight, let me talk to the social prescriber. Have you heard of that?
No, what is that?
So a social prescriber is a person who can, from our surgery, who can help with accommodation or and with assisted living and stuff. Would you be interested
Oh
in
yeah,
me
doctor.
referring you
Yeah,
there?
yeah. I think I need that, but I'm not sure, because also because of the bad experience that I'm going and I'm agitated, doctor. I need something to calm me down.
To calm you down. Um, hmm. I would like to examine you. How about like before prescribe like from the you mentioned agitated. Are you alluding to lorazepam?
Well, will lorazepam or something can make me relax a little bit, doctor? Because really, you can't imagine also
Love
with the itching,
calm.
doctor.
Mm, 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 mm. Uh, so I'm happy to prescribe another medication that's with itching.
Okay.
It's called antihistamine. It's called cyclizine. It helps with itching. And then and that is until I see you, examine
Yeah, yeah,
you, and
I know
then we will
cyclizine, doctor. It's not strong enough to make me. Yeah, it might help the itching, but it will not help me to Relax, doctor. My main worry is this, doctor. When my schizophrenia take the upper hand, I become bad. I don't want to hurt anyone.
No, do you feel safe
Yeah, I
in
feel safe
like
until now, but it has been like more than 24 hours that I didn't sleep. If I couldn't sleep, I'm
you
sure
didn't
that my
sleep?
schizophrenia will and I'll become aggressive. And now
I see.
if you will say to that social prescriber, and then they will take me to another place, so the people don't know me there. So I'm not
Mm,
sure if I will, I don't want to end up ending by section at the mental health,
the
hospital,
hospital.
doctor.
Okay. Um, so look, for tonight, I'm happy to prescribe a day or two of lorazepam then. Um, but then I will wait for I'll like to examine you, and then we'll see the social prescriber, and then hopefully we'll help with that. Is that okay?
Yeah, sure, doctor. Yeah, no problem.
Okay. Okay. And from now until I see you, if you feel that you are getting worse, or if you feel that the hallucinations are getting worse, either come back to us or call 111 or 999. Is that okay?
Sure, sure, doctor. Yeah,
Okay. Thank you.
thank well done. So
Thank you. It went over the time limits a little bit,
no,
but
that's
yeah.
fine. That's fine because it's multi-complicated case.
Yes.
There is a lot of layer of complexity here. But let's discuss
Hmm.
first. What you think you did fine, and what you think you might consider doing it differently.
Yeah. Um, I think, as you mentioned, there are multiple layers. So I was able to go through the layers one by one. I did not budge in immediately to say, "Oh, you want lorazepam? I'll give you lorazepam." I asked more. Um, when he mentioned the bed bugs, it kind of clicked that yes, like could it be hallucination or like visual hallucinations, or it could be something else. I tried to dig deep. I believe it is genuine,
It is.
like bed bugs
Yeah,
that they were
it is
talking
because he
about.
told. Yeah, it is because he told you I have picture and
Yeah,
he will come. That's true. Okay.
exactly.
Mhm.
I meant like my mind went into scabies, like just because of the situation and stuff. But the patient said that no, I can see bed bugs. I will need to still bring them in and see them. I think prescribing lorazepam is a good option after just explaining all of the risks and benefits, but also for a short period of time. And especially like with safety netting and stuff.
Yeah, I'm not against prescribing lorazepam, but the
Mm,
issue is there is a trick in the case that you didn't maybe get it. Okay,
hmm.
so the good thing here that you did try to to tease out why he's not sleeping. This is important. Okay, a lot of people, oh
Mm,
yeah, okay, he's mental health patient.
mm,
Okay, it's normal that they will not sleep. Okay, give him sedation and let him be sedated. So that was very good from you that you try to elicit that. Okay, probably you might need to ask more about the effect of being not sleeping, and more asking about how many hours he didn't sleep. Is he able at least to have half an hour sleep? Is he napping in the morning if these bugs is not active in the morning? So just to understand how the being unable to sleep affecting his mental health, that was crucial. Because okay, does he need admission then? Does he need to go now
yeah,
to the hospital to be admitted? Okay,
true, true.
because the schizophrenic patient is very easy to to just fire them out. It's very easy. Okay, so if they are not sleeping, they will lose the control and and the psychotic features. Okay, so because most probably the psychotic feature is always there, so hearing voices, seeing things, but is they have insight or not, this is the most important.
Mm,
Okay, and are they able to control the psychotic feature, okay, or not? Okay, if saying that I'm afraid that I will lose the control, and I'm afraid that I will be sectioned. He might be losing the control, but he don't want to say because he don't want to be sectioned. Okay, because
yeah,
still he
yeah.
have little bit of insight. So that won't needed to be teased out more. This is one. The other thing here, there is a massive mistake happened in the prescribing here. Yeah. So if you notice here, the patient was prescribed promethazine ticolate. So is that the medication that you are prescribing for sedation and sleeping?
It, to be honest, it is an unusual medication. But I assumed that, oh, they are the psychiatrist, they would know better and stuff. So I took it as a face
So,
value.
which is, well, they already they prescribe promethazine,
Mm,
okay, but how many promethazine you know? Yeah, well, this is
I
the
don't know.
trick. Okay, so
Mm,
promethazine is coming in two forms, either promethazine ticolate and promethazine hydrochloride. So promethazine hydrochloride it is something that we are using, for sleeping. Okay, actually, you can buy it, sometimes over the counter. So promethazine
yeah.
is something that we are prescribing, but actually there is two forms of promethazine. So
Mm,
promethazine hydrochloride is the sedative and the antihistaminic one.
mm.
Promethazine
Yeah.
ticolate is used for the nausea and motion sickness. Unfortunately, there is a mistake in the patient, in the psychiatrist. He write it by default. Okay, promethazine.
Yes.
Okay, so he
Yes.
write promethazine. He didn't specify what type of promethazine, and
Mm,
hence the GP just choose any promethazine there. Okay, and then uh, he choose the wrong one. The ticolate. Okay, is not the hydrochloride.
mm,
And this was a
mm,
big mistake, and that's why he's still itching, he's still not able to sleep. Because if he had the promethazine hydrochloride, at least will help him with the itching, because it's acting strong antihistamine, okay, with
mm.
sedative properties. So he will be able to sleep, but then he is 1 month taking the wrong medication, and that need to be emphasized.
Absolutely.
The other thing with the patient on antipsychotic, if you didn't see any follow-up for the patient, you can see there is no follow-up, no
Mm,
bloods, okay? Any patient on
yeah.
antipsychotic, he needs at least a yearly. If he is discharged from the from the psychotic drugs or psychotic medication clinic, which usually in the mental health hospital, then the follow-up of the antipsychotic medication is the responsibility according to the shared care management of the GP. So this patient will need yearly bloods and yearly ECG to see the the QTC interval. There is nothing
Yep.
here, nothing written, which is not
Mm,
unusual. Okay, a lot of patient will be missed, unfortunately.
yep.
So that need to be emphasized, okay, to show the examiner that you are thinking holistically about the patient. Okay, what about your follow-up? When was the last time you had the ECG? Yeah, and then it's not unwise to write for him something to make him sedated. Okay, lorazepam, that's fine. Okay,
Okay.
or correct the things. Write bromethazine, which I was waiting for you to say. Okay, bromethazine hydrochloride. I'm so sorry. Obviously, there is a mistake. Apologize and show that and be obvious, to the patient and tell him what
Yeah.
happened. Okay, and don't hide. Okay, duty
Yeah.
of
Yeah.
condor. You need to tell them. Okay,
Absolutely.
and then after that, you said, okay, we need to prescribe the promethazine hydrochloride, but then there is another trick here. If you prescribe the promethazine hydrochloride,
Is it
I,
the
I,
drug-drug interaction with
yes,
olanzapine? Is it?
yes,
Yeah.
exactly. So both of them are having anticholinergic properties. Both of
Mm-hmm.
them are increasing the QTC interval, and we don't have
Yep.
ECG here.
Mm-hmm.
So then, yeah, then okay, I will prescribe for you the other medication. You come, I need to do ECG for you to make sure that no QTC interval, and be aware that putting both of these medication together can cause you having dry mouth, blurred vision, and so the anticholinergic properties. Uh, we can, as a bridging therapy, write for you some lorazepam. That's not a problem. But the issue is lorazepam, as you know, it's an addictive medication, so we don't want to be on it for long term. Hence, as well, the promethazine, we don't like to keep it for long term for the patient. So the other mistake in the prescribing here is that the promethazine, if it is prescribed as sedative, it should be BRN.
As
So
needed,
no,
I
yeah, as
see.
needed, yeah. So that's also another mistake in the prescribing. Okay,
Yeah.
so that's all what is in the case, to be honest, is just knowing the types of the the salts of the medication that we are prescribing.
Yeah.
So promethazine specifically, hydrochloride and acid anticolate, okay, and the difference between them. The other thing, the protocol of follow-up of the antipsychotic medication is very important to know. The third
Yep.
thing is what is available help for that patient as emergency. As you said, okay, social prescriber, they can find him, emergency shelter or emergency housing other than the house he is in. He can, call the housing association and complain. He can, the social prescriber can call the council, okay, and make also complain. You can inform the safeguarding team because that's a vulnerable patient, and obviously
It
there is a
is.
problem in the supervised housing that he is in. If he told to the warden and the warden ignored, then that's mean that there is a problem, and then there might be another vulnerable patient then, and then they need to to look at these people and see what is going on. So maybe trying to discuss the case with the social care is important here as well. Okay.
Absolutely.
If there is infestation, the house, the housing associate, or even uh, the social team, okay, or the safeguarding team might consider, um, informing the environmental health team to go and see, because if it's infestation and spreading to the other houses, that's environmental health and it's a big issue. Okay, that's one of the things also might be
Mm,
considered. Okay.
absolutely.
Yeah, coming to the types of the promethazines, okay, you can see here promethazine can be either ticolate, either hydrochloride. Both of them are promethazine, but the salts inside them will make the usage of them is different. Okay, so the ticolate is the contain ticolate salt, hydrochloride contain hydrochloride salt, and that the ticolate is used in nausea and motion sickness, but then the hydrochloride is used as a sedation, nausea, and allergy. Okay, so the name of the hydrochloride is Phenargan. I'm sure you heard about
Mm,
Phenargan.
yeah.
So that's one that use it for allergy. Sometimes you are using it in sedation, in pre-operative sedation or pre-even operative intubation. Okay, and why is
Yep.
that? Because the hydrochloride is making it more rapid onset. Okay, but the ticolate is making it sustained release, so slow onset. It would not give us the sedative properties of the type this first generation of antihistamines. Okay.
Yeah.
um, so that's in general what I said, the summary of what I said, and then the interaction between the olanzapine and the promethazine. Okay, both of them are sedative. Okay, so if you will prescribe both of them, the patient at least need to have someone with him just in case of if he have severe sedation. The anticholinergic and the QT prolongation. Okay, so QT prolongation can precipitate to VTAC and VF, especially
Yeah.
if the QTC reach to 500 millisecond. Then
Mm,
that's very urgent and critical.
yeah.
Um, you would be able to consider prescribing for short term, provided that you did the ECG and the QTC show show normal interval. Okay, so that's the case in general. Okay, I would
Perfect.
close the recording and then
Yep.
we'll give you your specific feedback. Let me just close the recording.